Hey everyone, today I want to share a video with you regarding ketamine in relation to treatment for depression. This is a video that originally aired on the 7:30 report on the ABC in Australia, and I just want to jump in and put a couple of side notes in there.
The drug ketamine has a colourful history. When it was first developed more than 50 years ago, it was used as an anaesthetic on the battlefield during the Vietnam War. It's also been a horse sedative and a party drug known as Special K. Now ketamine is a possible breakthrough treatment for depression. But psychiatrists caution that while initial results are promising, more research is needed. Tracy Bowden reports.
Les Jackson has taken up the harmonica again. Music was just one of the things he lost interest in as he fought a losing battle against the black dog, depression.
Look, I was actually going really bad, scraping the bottom of the barrel, and when you think about taking your own life, you've got to be really down to, in a pretty desperate sense of mind, to even think about that.
And now you...
Yeah, no, I've come a long way.
You have?
Yeah, it has been really great, yeah.
Les Jackson tried several different antidepressant medications and underwent counselling, but nothing helped. Until now. Today he's receiving the latest in a series of injections of a drug called ketamine.
Just so much better than what I was before. I can't put it into words really, it's that good.
The results are startling. They're so good. They're not 100%. There are people who don't respond to ketamine, but the results are very, very good. Why I am passionate is my father had very severe depression.
Neuroscientist Associate Professor Graham Barrett has had a lifelong interest in the treatment of depression.
Come in.
He's medical director at a centre which has used ketamine to treat 30 patients with a 75% success rate.
Okay, so what's worth noting here is that SSRIs such as Zoloft, Prozac, Celexa have a 60 to 70% success rate. So to have another potential treatment for depression on the market with such a high success rate is huge.
This is not a trial per se. We are pioneering the use of ketamine in Australia, but ketamine as an antidepressant is well established in the USA, and it's now accepted mode of therapy, officially sanctioned, and Australia is lagging behind.
Okay, so this next point was a bit misleading. In the USA, ketamine hasn't been FDA approved. However, the treatment is available. It is also worth mentioning the treatment is actually quite a lot more expensive.
Sweet.
After 20 years of severe depression, Tanya McClure is another patient who's hopeful she's finally found the answer.
Do it now.
It's really good. Like, I used to wake up and go, I just can't be bothered. I just don't want to. And now it's like, yep, just going to go do it. I'm just happier and want to participate in a lot more things, which is good, which I never used to do.
Ketamine is best known as a party drug with the street name of Special K. Users can experience hallucinations and distortions of time, sights and sounds. Its recreational use is illegal.
That dose is a wham, hits the brain instantly. What we give is approximately 100 times smaller dose.
Ketamine is clinically approved in Australia by the Therapeutic Goods Administration for use as an anaesthetic and in pain control. It can be used to treat depression in the context of a clinical trial.
So it's truly amazing both in terms of how powerful the effect is, but also how quickly it works. Because other treatments that we know, medication, psychological therapy, ECT, electroconvulsive therapy, take weeks to work. So the fact that you can go from being depressed to being well in one day is unheard of.
Professor Colleen Liu has carried out trials on the drug at the University of New South Wales and is seeking extra funding to continue her research. Do you know why ketamine works?
It works by really reversing some of the changes that happen in the brain when people are depressed. So what studies have shown is that when you're depressed, some of your nerve cells actually shrink, and that's why your brain doesn't work well. And we know from studies in the lab that when you give people ketamine, or animals ketamine, that it strongly promotes the regrowth of those nerve cells.
Graham Barrett says his medical team is providing ketamine at $150 a treatment, with from 5 to 25 treatments required. But some psychiatrists are urging caution.
We need to study this carefully in a research setting to work out how do we get a lasting effect, what do we need to do to get a lasting effect, and is it safe? Before we say to people, here we go, this is a fantastic new treatment for depression. I also understand that people are desperate, people who haven't got well with other treatments, that they're desperate to try something new. However, I think it's too early for us to be releasing ketamine into general clinical treatment for good reasons.
The Therapeutic Goods Administration doesn't regulate or control the prescribing of registered drugs outside of their approved uses, and in such cases can't vouch for the quality, safety or efficacy of the product.
This stuff is real, it works, and we should be encouraging people who need it to come and be treated and get treated and get their lives back.
Patients with first-hand experience of the impact of ketamine hope the drug will soon become readily available.
I've gone back to some of my old interests, playing a bit of music and things like that, and actually trying to get back to work and organise a business for myself. And it's good to actually find something that can battle the problem that you've been having after you've tried so many different avenues, and then you get a successful one. Geez, it's been so good. It's really wonderful, it is.
Tracy Bowden with that report.
Okay guys, thanks for watching, and thanks to the ABC for airing this information on ketamine. If you want to subscribe to my channel, I'm going to have more videos up on depression, and some of those treatments will be a lot cheaper and more accessible to you.